Hey,
Hello.
hello to everybody, and to you, Rick, of course. So welcome to our event today. We're very glad that you're here. And I don't know where you are, but here it is. I was just got an alert on my phone that the District of Columbia now has almost met the record for 90-degree plus days. So it's hot here, it's humid here, it's summer here.
It was like 100 in Burbank up until about a week ago, and now it's in the 80s. So pretty nice actually for Southern California.
Well, that's right, because we're indoors as usual. And so I should have started by saying, my name is Ann Merchant, and I work for the National Academy of Sciences.
I'm Rick Lovard. I work for the National Academy of Sciences as well. I'm the program director of the Science and Entertainment Exchange.
And so we always start a little bit the same way. My job is to explain, for those of you who have not attended our events before, a little bit about what the National Academy of Sciences is and does. And for those of you who have heard this before or could do it for me, this is when you can probably run out and get a glass of water or maybe something else to start the event. But the National Academy of Sciences is a private nonprofit institution that was created in 1863. We always like to remind people that Abraham Lincoln was the president that signed us into existence by executive order, with the notion that the government needed good, sound, evidence-based advice to be able to create policy that would be to the benefit of all the people. And so I was looking at what was recently released from the academies. We have just released today nutritional guidelines for infants and children between the ages of birth and 2 years old, so that if that's relevant to you or someone you know, you can look that up on our website. All of our reports are free to download and to read from nap.edu. We also have very relevant advice today. It's guidelines for reopening schools. You probably don't even have to go to our website, because I know it's hitting a lot of major newspapers across the country. Depending upon the paper that you're reading, though, sometimes our reports, there's a little bit of something for everyone. So going to our website, you might be able to get the real scoop from our report. And we are hard at work on a set of formal recommendations, which is very relevant to today's event, on the distribution of vaccines, and those recommendations will come out in the fall. So that's something to look forward to. And our committee from the National Academy of Medicine and our Health and Medicine Division is assembling now and working on those guidelines. But the other thing that's relevant today is the Science and Entertainment Exchange, which is the formal host for this event. And Rick, as he said, is the program director. And so I'm going to turn it over to him to explain about what that program is.
Yeah, so for those of you who have never been to an exchange event before and are joining us for the first time, the Science and Entertainment Exchange is a nonprofit outreach of the National Academy of Sciences. If you are a writer, producer, director, if you're creating a story for mainstream media and you have a question about science, you can call our hotline, which is 844-NEED-SCI, or email me or Sachi Gerben, who also works for the program, and we will connect you with a field expert for free. We've done over 300 events like this, and also live in the real world when we're not under lockdown. And we've done over 3,200 consults, including Avengers Infinity War, Man of Steel, Black Panther, Captain Marvel, and the recent release Palm Springs. If you're looking for something to watch and are interested in the kind of work we do, we did a consult on that film. And if you are a STEM professional and you're just joining in, you're like, what? There's this program, then please don't hesitate to contact us. We're always looking for people to introduce to storytellers. And so we're always on the lookout for field experts. Quick note about today, you're gonna hear a conversation. It's gonna be a moderated conversation. And down here somewhere, should be a little button that says Q&A. You can click that at any time in the conversation, even before they start actually officially taking questions, and ask a question. And I'm going to be sort of editing those and slipping them to our moderator, who will try to work them in. We're going to try to get to as many questions as possible. As usual for our events, we have an excruciatingly short period of time to actually answer audience questions. and we're going to do our best to get to as many as possible. My apologies in advance if we didn't get to your, it's clearly my fault. And I wanted to say a quick thank you to the folks who made today happen. Our AV team leader, Ameche, without you, we would be lost. Our team in DC, Courtney Sloan and Jeff Fishman, and of course, the aforementioned Sachi Gerben from the Science and Entertainment Exchange. Thank you all. And last, but definitely not least, I need to thank our sponsors, Howard Hughes Medical Institute, without whom this event today would not be happening. They actually sponsor our events in particular. So thank you to HHMI, the Alfred P. Sloan Foundation, Walt Disney Company, Film Nation, Google, Lyda Hill Foundation, and Corteva, and individual donors like many of you who donated today for this event. Thank you for giving. It goes right back into making more of these events and making these events possible. So thank you.
And we've been really happy to be able to do these events. We've been doing, we quickly pivoted to this Zoom platform, and I know a lot of you are probably zoomed out, but we've been very happy to be able to do these events. And our virtual room is much bigger than the actual venues that we do in-person events. So it's been really great that we've been welcoming so many of you on a regular basis. And we'll be doing events probably through mid-August. We'll take a couple weeks off in August and then come back in September. So thank you for being here. I've made it a bit of a tradition in these virtual worlds to have a couple of things that I mentioned at the top. So I wanted to mention that I have participated in a project of the Boston Public Library. It's the Anti-Slavery Manuscript Transcription Project. And if you log on, they'll give you a letter or document. It's crowdsourcing the transcription of these documents that they can't easily digitize. And they'll give you something, and you just type what you read verbatim, and then that's how they're adding to these documents that they couldn't otherwise easily create. So go ahead and do that, because I think that's important to do. And it's something that I found kind of interesting. The other thing is that I did receive, I've mentioned this before, I received my baby chicks in the mail today. Yes, you can order baby chickens in the mail, and this time they all arrived alive. So I wanted to show you my baby chickens. Yes, there they are. They're all alive, every one of them. And there were 6 of them. How cute is that? How can you not be happy about little baby chickens in the mail?
One's alive.
There we go, see? So that's something I'm enjoying. Also, my box of 6 bottles of wine arrived, also all intact. So that was good news for me. It's not a canned good, Rick. I'm not gonna hold up a canned good.
And I have no baby chickens, only these. They require much less food, but have not yet yielded me an egg. But that's all. That's all I got for you.
Yeah, this is going to be like a $3,000 egg by the time I get these eggs, because this was not for the purposes of saving money on eggs, but it's making me very happy to have these tiny little chickens. The other thing that's making me very happy, so there's 2 things I wanted to say also, is that first, I will not be introducing formally Sunny Bates, our moderator, because she's going to come on kind of in between, and I won't have a chance to do that. I'm looking at her Zoom picture, and it is perfect. She's holding a dog. Sunny, there's a description of Sunny that you got when you got your invitation. It's perfect, Sunny. All I will say to you is that if I could be somebody, if I could grow up to be somebody, I would want to be Sunny Bates. She's the most amazing person in the world. She's awesome. I just think the world of her, and I've known her since the exchange launched, and I'm so happy that she's moderating the conversation today. She's full of energy, full of just so much intelligence and vibrance, that I think that you will really enjoy this conversation, not because we don't have an amazing group of people that will contribute their expertise, but also because we just have a wonderful moderator. But to start us off, I think that because this program combines both the creative sentiment that comes from the entertainment side of the Science and Entertainment Exchange, as well as the science, we were very fortunate, and because of Sunny, to be able to bring in in a creative voice to start off this conversation. So Jeannie Moutoussamy is joining us, Moutoussamy-Ashe. I was very careful to try to get the pronunciation of Jeannie's name, but then wanted to make sure I got the Ashe, which is the easy part to pronounce, to kick us off today. And Jeannie is a longtime AIDS activist, an extremely talented photographer, and also part of the Human Vaccine Project's Council, Futures Council. And so we're really happy that Jeannie's going to give us a little opening, and then she'll pass it on to the amazing Sunny Bates. So I'm going to hand it to you, Jeannie, and thank you for that.
Thank you so much, Anne. It is such a pleasure to be a part of this event today. I am a fine art photographer, and I am so glad to be a part of these esteemed professionals for this most important topic of developing human vaccines in this time of COVID-19. Wayne Koff is one of the world's experts on vaccine development and served for many years as Chief Scientific Officer and Senior Vice President of Research and Development at the International AIDS Vaccine Initiative, also known as IAVI in New York City, leading IAVI's research and development programs. And this is how I met Wayne Koff. My husband died of AIDS in 1993. So I've been involved in the fight to defeat AIDS since the late 80s. And artists always seek ways of communicating their feelings on the human condition. As a photographer, one of my projects was a children's book called Daddy and Me. Our daughter was 6 years old when her dad died of AIDS. And in the early 90s, it was not only a difficult subject to talk about, but it seemed impossible to explain to a 6-year-old child. So we began by documenting my daughter and my husband's loving relationship during his illness, and the result was something that my daughter not only understood, but she was very proud of as well. The ability to form language that she could understand was critical. This is what we were trying to achieve, and Daddy and Me empowered that. So here we are, decades later, in the midst of a global pandemic, continuing to see with increasing urgency how a virus can ravage families, communities, and countries. We need to have the language to discuss these difficult topics. The world understands with increasing urgency the need to have a different way of preventing, treating, and defeating deadly viruses and diseases. And today we have with us Wayne Koff and Ted Sheckelberg, co-founders of the Human Vaccine Project. And I am going to turn it over now to Sunny Bates. Sunny, would you like to continue the introductions? Thank you.
Indeed. Yes, I would be delighted. And we also have in our group Ann Barnhill, who will be speaking with you. So we're going to launch with Wayne. And why don't you frame up, there's so many questions already in the Q&A about vaccines and about what's happening in the world right now. So Wayne, can we get you on screen and have you talk to us about the state of the world right now and vaccines and what the Human Vaccines Project is all about?
Sure, Sunny. It's wonderful to be here. And are you guys able to see me? Am I on? Okay, good. Anyway, I think back to when I was at the NIH in '86, in the really early days of HIV vaccine development, and we thought it was going to be easy. And so I was asked at a meeting in the late '80s, when are we going to have an HIV vaccine? And I said, well, we've had great successes over the years with measles and polio and other diseases, and we know how to make a vaccine. So this one shouldn't be that difficult. Well, as we all know, it turned out to be extremely difficult. And there is a reason for that. HIV, unlike any other virus that we've ever seen, we have to improve upon the human immune system. Because if you're infected with HIV and you don't have antiretrovirals, it destroys the immune system. And we didn't know how to do that. And we don't know how to do that. And that was actually the kernel of the ideas of the Human Vaccines Project. Because although we know a lot about the pathogen, in that case, HIV, we don't know a lot about the human immune system, which is the core of the way all of our bodies are effective against any disease. And so we've got these wonderful vaccines, as I mentioned. And in the public's eye, when we think of a vaccine, we think of a single shot and 100% efficacy. But that isn't reality. The reality is that everybody's immune system is different. And everybody sees a vaccine a little differently. And so we decided after fighting HIV and trying to make an HIV vaccine for all those years, that unless we understood the human immune system at the molecular level, we wouldn't be able to make an HIV vaccine. We wouldn't be able to make any vaccines against cancers and Alzheimer's and autoimmune diseases, etc. And now COVID comes along. And COVID is an interesting virus. It's not as difficult as HIV. It's not a variable virus, so it's not a moving target. It doesn't really wreak havoc on the human immune system. But what's really interesting about COVID is that the worst of the disease is in the elderly. And so when we think about how we're going to make a vaccine against this virus, not only do we have to make a safe and effective vaccine, we have to make the vaccine to ensure that it's going to work in those most of the vulnerable. And that is the elderly and those in the developing world, and in the United States, as it turns out, also in the African American community and in the Latino community. So I'll be really brief here, but in essence, the way we look at the COVID vaccine right now is we have three scenarios. There's 185 candidate vaccines in the pipeline now. And there's about a dozen or so that are really marching along in testing in people. If all goes extremely well, we will have a vaccine in the early part of next year. The priority of that, or the probability of that, is extremely low because vaccine development is a complex enterprise. It usually takes a decade. And everything that we do in sequence in vaccine development, whether it's the testing in the animal models or the initial testing of safety in people, or eventual testing of the efficacy in larger numbers of people, is now all being done in parallel. And so we're taking a lot of risks. On the other extreme, it may turn out that these vaccines are not safe. And if they aren't safe, then it's really going to take us a long time to make a vaccine against this disease. The most probable of the scenario is that we will see some level of efficacy of the vaccines, of the first set of vaccines, within a year, and they will be safe. And the question is, will they get over the bar of the level of efficacy that we actually are looking for a licensed vaccine? And we'll talk about that a little more in the Q&A. So I think I'll stop there, Sunny. And are you going to turn it over to?
Yeah, I'd love to. I just had a generator start in my background, so I was going to make a quick move as we do. But yeah, I'd love for Anne to kind of jump in. So you've got these three scenarios of best case, early next year, worst case, it'll go on for a long time, somewhere in the middle, looking at different possible other kinds of treatments as a possibility. I think we're already getting a lot of questions in here, looking at the ethical issues, looking at some of the challenges that we'll have about who will take do we mandate vaccines? Do we mandate treatment? what might that look like? So I'd love and for you to come in and talk to us about some of the ethical issues and some of the challenges that you see that will be most likely parts of these scenarios.
Yeah, great. Thanks, Sunny. Yeah, I've been thinking about like some of the ethical issues that will arise if and when, like a big if, right? Big if and who knows when, building on what Wayne just said. So if and when there is a COVID vaccine, what are the main ethical issues we might see? And, as Anne mentioned in the introduction, people are already talking about prioritization. So that's a big issue. If and when a vaccine is developed and approved, there won't be enough of it to begin with to give to everyone. So who should be offered the vaccine first? So should we see the vaccine as a tool to protect people who are the most vulnerable? So should we offer it first to older people because they're at higher risk of severe illness and death, or people with underlying medical conditions who put them at higher risk of severe illness or death? Or in the United States, as Wayne mentioned, we've seen much higher rates of infection and death among Black people and Latino people. So should it be offered to them first? Or should we use the vaccine to just reduce transmission, right, as quickly as possible? Should we see it as a public health tool to help us achieve herd immunity? Should we prioritize essential workers because we need them to keep working and because we owe it to them for the risk they've been undertaking? So there are lots of ethical issues there with prioritization. And I think a real need to get public input on those decisions as well, to not just have it be a group of experts in a room making these decisions, but to really hear from the public so the public can articulate their values and then also have confidence in how these decisions are being made. So that's one issue, prioritization. And then access. So even if on paper, you're in the top tier group of people who should get the vaccine first on paper, you may not have access to it. You may not have health insurance, or you may not have health insurance anymore because you lost your job and you lost your health insurance. So if the vaccine isn't free, can you afford it? Or you may not have geographic access to the vaccine. So will there be a convenient place? Will there be a place that is geographically accessible to you where you feel safe going and getting the vaccine? So some people have suggested we really need to think out of the box here. Think about offering people's vaccines in senior centers or houses of worship. So access is another big issue. And then acceptability. I think a couple people have mentioned, there's some survey data that maybe 70% in the United States, maybe 70% of people in the United States right now would choose to get a vaccine. So how can we increase the acceptability of vaccines? If there are safe and effective vaccines that are developed, what can we do to increase the acceptability of those vaccines? And really listen to what people's concerns are and meet them where they are. And then I think someone also mentioned mandates. This is a perennial ethical issue with vaccines. So if not everyone is willing to get a vaccine, is it ethical, or under what circumstances is it ethical to mandate that they get it? So for example, to require people who work in hospitals to get a vaccine as a condition of returning to work, or requiring teachers and school workers, for example, or another example would be residential colleges. So would it be okay for colleges to require students who are coming back to the dorms to get a vaccine before they're allowed to come back? So when I look at what's happening in the United States and the ethical issues that might arise, those are the major ones there. And then globally, always the major ethical issue is equitable and effective distribution of vaccines. So if and when a vaccine or vaccines are approved, how do we make sure they are distributed around the world in an equitable way, in a way that will effectively quell the pandemic? And the worry here is that the richest countries will buy up vaccine to protect their own populations, and preventing vaccines from being distributed globally in an equitable way, but also in a way that quells the pandemic most effectively. Yeah, so those are some of the ethical issues, really a lot. Yeah.
Indeed. I'm wondering, Ted, if you want to kind of jump in now, and then I'd love for us to have a little bit more of a conversation, because there's so much that, both from our ability to think about, what the timeframes you're talking about, to think about these ethical issues when you dive in, and you mentioned, you don't have access if you don't have healthcare insurance. There's questions around, will they be political decision? Will they be in this fractured political time? What does that look like? Ted, you want to jump in for a bit?
Yeah, sure. So one of the things that we think about is, sort of equity in the sense of global health and health equity. And I think the issue of COVID-19 really highlights that. Traditionally, the greatest burden of the disease, where most disease is in lower resource settings, developing countries. And yet most of the product development has occurred in industrial countries. And so there's been a mismatch. And, through the 2000s, through actions like the Gates Foundation, Gavi, and where we were spun out of the International AIDS Vaccine Initiative, IAVI, there was a trend to start to work with scientists and populations in developing countries so that we can tailor and design vaccines to work in those contexts. Immunologically, different environments can lead to different outcomes in vaccines. And because people have different nutrition statuses, or they might have different infections, like you might be infected with HIV or TB in the context of the developing world, it'll make your outcomes to both the disease and the vaccine really different. And so one of the things that we've been working on at the Human Vaccines Project is something called the COVID Vaccine Initiative, which is to work in the context of developing countries and work with scientists there so that we can test these vaccines in the populations that are most affected, and do so in a safe and ethical manner, where we engage communities, and we engage local scientists, we engage the ministries of health there, so that not only are they participating on the research end, but they're also plugged in later on the access end. So there's really the two ends. Does the vaccine work in the populations that are most at risk, that are most vulnerable, and do they have accessibility? And so we're one part of many groups that are doing this, but the world right now has an opportunity to address this on the research side and the accessibility side, so this virus doesn't become endemic, doesn't become lodged in these populations for 10 years, undermining economies, undermining health. And if we have the proper investment and we do the proper research, we have an opportunity to really make sure this doesn't end up like HIV, where 30 years later, we still see immense burden of disease in the poorest and most vulnerable. And I think we have the potential to do things differently. The question is, will we be able to follow through on
that? A question. There's such momentum around COVID-19 and around the vaccine development at this moment. So all eyes, all attention, massive amounts of resources globally has taken place. The kind of sharing and collaboration seems to be happening in a way, and I know that's sort of underpins what the Human Vaccine Project is about. Do you see this moment as potentially being a real opportunity for a different way of approaching what will probably be more common global health issues, pandemics, where we need global solutions and global actors? We can't act locally anymore. We're too global a population.
Mm-hmm.
Who wants to take that one?
Absolutely, Sunny. Absolutely. I think that the one of the silver linings, if you will, of the pandemic is going to be the world of research and development and access of vaccines, frankly, is going to change radically, is changing radically. And so, we've already seen in the Human Vaccines Project, as just as one example, there's a huge amount of data now. And the old way of doing R&D was in companies and whatever is to hire 100 of the postdocs and look at a large amount of data. Now it's all a merging of the human immunology and the artificial intelligence as one example. And so we're bringing in a lot of other players into the vaccine R&D space. And I think in terms of the access issue, as Ted has pointed out, it's really interesting. Even if we had a COVID vaccine now, we're really good as a world in terms of the delivery of vaccines to infants and kids. We're not so good in getting vaccines to adults and elderly. And COVID is going to force us to learn how to do that.
Interesting. A lot of questions that are coming up here have to do with, in the absence of or in the delay of the vaccine. I think all of us are so anxious to see the world go back to normal, whatever a new normal is. What are some potentials for treatments? I mean, looking back at AIDS and the fact that it is, it's treatable. It's not able to be vaccinated against. But so what are the possibilities of treatments along the way with COVID that might be possible to stem the effects of this monstrous disease?
I think that's a really excellent question. And I think it's going to be, as we saw with HIV, the antivirals are going to roll out. The antibodies against the virus are going to roll out as a prophylaxis and as a treatment. And so in the best of the scenarios, we have a vaccine a year from now. It's very likely at the end of the year, at the end of this calendar year, we're going to have a series of the human antibodies that have been identified that are already into test, which are going to help in terms of the amelioration of this severe disease. And so I think this is going to follow almost in a similar way as we saw with HIV. It took a while with HIV because HIV was a lot more complicated than this virus, and we didn't have the tools in the 80s and 90s that we have now. It only takes us now a couple of months to identify a virus, identify the target, identify the antibody we want to make, and make that antibody. And so you're going to see over the coming 6 or 9 months or so, a series of the advances that are going to ameliorate the disease.
And hopefully, over the next year, I think, on the medical side, on the treatment side, I think, doctors are going to figure out with the existing tools, do ventilators work better or not? What are the best medical protocols to treat the disease? On the behavioral side, we're learning that social distancing and masks are pretty effective. And then we're going to have new antivirals and monoclonals, hopefully, as Wayne said, and then a vaccine, which may not work that well, but in the context of this kind of portfolio approach where we can, better modify our behavior, we can have better, treatments or prophylaxis. We'll have a vaccine which may or may not be, particularly effective. I think all those things can put us in a much better place than we are now, where we're just scrambling to catch up and we're trying to do the science and figure out the best medical practice as we're sailing the ship.
One of the questions that come up here, it's interesting, is that as we have private companies, for-profit companies that are developing these vaccines and under an enormous amount of R&D budgets, and we live in most of these are in the private sector rather than public. I mean, I don't know, Wayne, Ted, Anne, are there vaccines that are being developed by any governments? Or are they all private sector organizations or consortiums?
Mm-hmm. Yeah, that's a good question.
Do you want to go ahead, Anne?
Yeah, just in the United States, the federal government has reached agreements with a few, or several companies that are developing vaccines, and has given them funding, and in exchange for the promise to get, an allocation of the vaccines they develop. Yeah, that's a good question. Yeah.
It does become then, is it ethical to charge for vaccines during a pandemic is another question too, right?
I think on that, at the end of the day, it's going to be the industries that are going to make the vaccines. It's the industries who know how to make vaccines. But as Anne's pointed out, the government and the public sector is leveraging billions of dollars now in support of these, and so that is going to be one of the many issues in terms of access of the vaccines at the end of the day, and the pricing of the vaccines is going to be factored in.
Can you talk a little bit about herd immunity? I keep hearing, and there's questions about this of are we, at what point, what percentage of the population has to have been exposed, or where are we in the curve that we have herd immunity with in the absence of a vaccine, or do we never have it?
Well, in general, and there isn't an exact number, but in general, that you want to have about 3 out of 4 individuals who have effective immunity in the population to be able to have what is known as the herd immunity, which is basically a way of slowing down the virus. And just as an example, if I'm infected and I meet you and you've got antibodies against the virus, you're not going to be infected. I meet another person who's also got antibodies against the virus, they aren't going to be infected. I meet a third person who is naive, they will become infected. And so you need to have 75%, 80% or so of the population really immune to be able to have that in a level of the population immunity.
So,
and we don't have that now. I mean, we don't have that now. We have, it's 10 or 15% of the population are infected. So we got a long way to go for that.
And we don't know how long the immunity lasts. There's a number. There may be reinfections, and
right
in the field within the various versions of coronavirus, from MERS to common cold, immunity may last a couple months, in some cases up to 10 years in the case of SARS. So we don't really know where we are in this virus. We don't know, how good the vaccines will be in generating longer term immunity.
question, what stories are not being told right now that need to be told? We've got a group of storytellers here. You all are on the front lines.
Yeah, that's a great question.
Right, Jeannie, yours.
As a storyteller, I think these stories need to be told obviously for a lot of reasons. But once we see how people are impacted, we're not really seeing a lot of the deep stories about COVID-19 and the infections. We're seeing what's happening with our healthcare workers. We're seeing people coming into the hospital. We're seeing people released from the hospital. But the stories, I think, are what impact us the most. Storytelling is a powerful thing. And I think that will capture the attention of people more than anything. And a lot of that is because most of it we don't understand. Most of it, a lot of people don't take it seriously enough. And I think storytelling brings people closer. So as I tried to do with the children's book, I think that it's important that there's a conversation going on. And if it's not going on, then we're not going to be able to understand the enormity of this problem. And storytelling is a way to do it. The scientific aspect of the disease is important, and we need to know about it. I can't even wrap my mind around it, but I can understand how storytelling can bring people closer to something that they really are not. Those people who have not been infected or don't know that they're infected, or are taking chances by not wearing masks. These are, I think, opportunities for them to learn, for everyone to learn from these stories of infection, these stories of how it happens. I think that's very, very important.
Yeah, I think also, Sunny, just to build on that, I think there's a lot of the myths out there about COVID. There is a myth that this is only a disease of the elderly. And the reality is that the kids are getting as many of the infections as the elderly are. And some kids are getting extremely ill with all kinds of syndromes that are way beyond the respiratory syndromes that we hear the most about. I think the second issue is that there's a lot of what that Mike Osterholm he refers to as the happy talk on vaccines in the media. And the reality is we've only known about the virus for a matter of months, and we're learning every day about this virus, and it's more of a complex a virus than we ever thought. And so it has cardiovascular effects, it has the neurological effects and such. And so I think there's been a lack of candor. And I think it's going to come back and haunt us at some point along the way. And of course, the last of the stories is the economic story. Here we have it's tens of millions of people out of work, and we have the markets at the highest they've ever been. This is going to turn around, and when it turns around, it's going to get really ugly. It already is ugly. And so I think we just have to understand, as Jeannie said, that we have to be honest. We have to tell people what we know, and more importantly, we have to tell people what we don't know, which is a lot at this point in time.
Yeah. Question, Anne, I'm wondering your thinking around the stories that aren't being told. I mean, you mentioned mandating before, and there's in the absence of the vaccine, what could if everybody wore masks, how much would that flatten the curve? Is there mandating? Is that possible? I'm just curious about the stories that are not being told as you see them.
Yeah, I think the question of masks is a really important one. So it is a simple thing that people can do to reduce the risk that they are posing to other people and to themselves. And so I think masks are incredibly important. Even with masks, I think we need to try and listen and hear people's stories. So not everyone gets treated the same way when they have a mask on. So for example, a Black man in the United States who was wearing a mask may be treated with more suspicion than me when I'm wearing a mask. And so even something like masks, which I think are incredibly important, I think there too, we need to listen to people's stories, and we need to recognize what these measures really cost people and how we can reduce those costs. Another kind of story that I think has been told, but still deserves retelling on a daily basis, is essential workers. This is, back to something Jeannie was saying. So to just, tell the stories of essential workers who are afraid for themselves or afraid for their families, but are still going to work every day, and they're doing their jobs. They're in maybe a grocery store encountering hundreds of people a day, or they are cleaning rooms in a hospital where COVID patients have been treated, and they're afraid for themselves. And there are these really heart-wrenching stories of essential workers who then go home and, they don't hug their families, or they sleep in the garage because they don't want to infect their families. And I think, telling those stories to help people understand what is at stake with their own behavior and their own choices seems important and valuable. Mm-hmm. And the essential workers who don't always get seen as well.
Yeah. Now I'm going to go geeky for a minute. Is there a single set or a set of human biological characteristics, not actions, that resist COVID-19 that we are aware of?
Single set of, that's a great question. That's one of the known unknowns. I don't think there is a set at this point in time. That's one of the things that at the Human Vaccines Project, the major underlying question that we are asking is who's protected, who is not protected, and why.
Mm-hmm.
And what's coming out of the initial set of studies is something that is known as the baseline, is predictive of the outcome. And so what I mean by that is everybody's had this experience where they go into an office and somebody has a cold, and if there are 8 or 10 people in the office, 2 or 3 of the people are going to come down with a horrific respiratory disease. Another couple are going to get a mild cold, and the other 2 are not going to get anything. This is because the immune systems of those who got the worst or the severe of the disease is weaker than those who didn't. And we're seeing this play out over and over and over again in the face of COVID. The immune system of somebody who's 80 years old might be as good as somebody who is 40, and vice versa. And so we're learning every day about something that is known as an immune age. But at this point in time, I don't think we have a set of the biological markers yet, which is going to indicate who is susceptible and who isn't susceptible and why.
Kind of following up on that, there's a number of questions here in the Q&A around certain blood types that have distinctly different disease outcomes. Has any of that been verified, or is that just something that we've seen tweaks of, and but it's not necessarily verified?
Yeah, I still think, there is some of the anecdotal data, and certainly some of the worst disease outcomes are in the men as opposed to in the women. I think it's 60-40 or 65-35, something like that. But it's a little early, Sunny, to be able to answer that. I still think it's basically anecdotal.
And how about the question of the coronavirus hospital data that's now going to be sent to the administration instead of the CDC?
It's another one of the awful decisions that the White House has done in this pandemic. I was actually on a call earlier today. I was speaking with a person in CDC about that, and they're flabbergasted. There's absolutely is no reason for it, and it's not going to help.
And any thoughts about that when you get from an ethical issue and where that puts us? And
yeah, I think that for weeks and months, this is something that has been on my mind. Just the availability of data, and the availability of data that is fine-grained enough to let us really grapple with the important ethical questions. So, for example, something that troubles me a lot is as we've already talked about, is the higher death rate we see among Black people and Latino people in the United States. Something that I have been wondering about, and me and some of my colleagues have been wondering about for months really, is do we also see higher rates of death among younger people? So 12% of COVID-related deaths in the United States are among people younger than 65. And so we were wondering, do we see higher rates than that among some population groups, such as Latinos and Blacks? And, I had a couple of students who were trying to look into it, and the data just wasn't available. And then I just saw recently, a week or two ago, that the New York Times had sued to get this data from the CDC, and then had this just really interesting and troubling article. The data report in the article was troubling about the racial disparities in COVID deaths. So I think that's incredibly important. I think the data and fine-grained data is really important to get a handle on the most basic ethical issues about equity and disparate impact.
Interesting. Okay, question having to do again, quite granular. US versus Europe, that now that we've crossed the 1% of our population being infected, our meaning the US population being infected, which is more than twice the infection rate in many European countries, but the US fatality rate is around 5%. I'm reading this question. I don't know exactly if this is true, so we can weigh in on both of us, which is significantly less than the US and Italy and Spain. Why is the European fatality rate higher than in the US, and how might this affect vaccine development distribution? Or do we get into aging and immune systems and?
Yeah, I think Sunny, it's too early to really analyze all of that. I think there's a lot of factors. I mean, one of the initial factors is that the count of the actual cases is likely to be underreported, as is the count of the COVID infections. And so, we probably have 10 or 15x over the numbers that we actually are seeing every night on CNN. And the same is the case for Europe. And until there's a real aggregation of the data, and Anne might be able to speak to this because the best data is basically is really annotated every night on the Hopkins website. But to be able to tease out, why that, one country is doing a lot better than another country, or one region of a country is doing a lot better than another region, it's still a little early because we don't have all the data.
Mm-hmm.
Question about to Jeannie, what do you see as the role of arts and artists in the pandemic?
Storytelling is the big thing. When there's a crisis, when we're faced with difficult times that we cannot really verbalize, that's when artists really get to work. And I think that it's important that it's a form of communication any language can understand. So no matter what's happening globally, and this is a global crisis, we need to see how other people are living with this pandemic. We need to understand how it works in other countries. And speaking to what Wayne was just talking about, that's so poignant, because it's absolutely true. We are operating on a very different level. I mean, I think artists are leaders in that sense. And I think we need leadership in a crisis. We need people to be able to, if you can't find a solution, you can offer thoughts and ideas that can create solutions. You have to be innovative, and artists are innovative. So to answer the question, artists just need to get to work. I think, and I know a lot who are, and I think it's important. It's an important time for artists of color to be seen, to be recognized, and artists who are directly affected. I mean, we're all affected by this crisis. I don't mean to say that anyone's being affected more than others, but I think we all need an understanding of how this has an impact on different people. And artists take that approach. Artists of color can help people who are not of color understand how we feel, what we're dealing with in our community. And we're looking for equality. And I think that that's something that artists can communicate in ways that words don't. It's an important challenge at this time, and I believe artists are up to it, whether you're in film, whether you're photography, painting, sculpture, performance art. I think all of that is really important, and I think we're going to be seeing more and more of it. So from an artist's perspective, we got to get to work.
Great. I'd love to ask a question for each one of you now, which is, you could choose any role right now in the world, what would that role be and what would you do? And let's just assume we might have some kind of form of a reasonable form of compliance. I can't believe I'm saying that, but something what, you know, you could choose a role. What would your role be? And what would you hope to, where would it be? What would you hope to accomplish?
I would want to be a school czar.
A school czar?
School czar with unlimited money in order.
Globally or where?
I'll just stick to the United States for now, and to try and really think out of the box about and fund, like, how do we get kids back in school? And it may not look like school that we've seen, and we may need to hire a bunch of extra people. You know, may need to hire a bunch of, you know, counselors in their 20s to spend time with the kids. But that's what I would do, because I think it is so important to get kids back to school, and there are really legitimate concerns that teachers and school workers and parents have. And so we just need to throw a lot of resources and creativity at that problem. So schools are.
And do you have children?
I do.
I was going to say, you're like, we've got to figure out something, otherwise I'll never be able to work again.
Figure out this problem.
Okay. How about you, Ted?
Sure, the role, but I think it goes back to this issue of global equity and health, and, you know, being if we could bring the world to a point where we're really investing in the places that have the greatest impact from disease, and building the health systems, building the research systems, and building the access, so that this doesn't end up like HIV or a lot of the other diseases that became stuck in these populations without access to care and technology that we take for granted.
How about you, Wayne?
I'm going to think about this a little, you know, from a different angle, and that is there's an unprecedented amount of the collaboration across the world now on this one virus, and we have other global problems, and one of them is it's getting hotter every day. In case people haven't noticed, we have a climate change problem. And this is going to take unprecedented amount of the global collaboration. And so if there is a role, I would like to be the intermediary between what are the silver linings that have come out of the collaboration here, in using those on our next of the major challenges, which I think is going to be climate change.
Mm-hmm. Jeannie, you have anything you'd like to, a role you'd like to assume? And
well, first of all, let me say I vote for Anne for school czar. I think I think that's a terrific idea. So let me put that out there. Actually, you know, I think what I'm doing now is exactly what I want to be doing. Being a storyteller, being a visual, being visually literate in a way that could hopefully help empower other artists whose work is possibly not been seen yet, or artists whose work I'd love to help empower other artists, because it's such a wonderful opportunity and a way to live your life in being in a position of, one, loving what you do, and two, making a difference, and being able to communicate with anyone how you feel about the world and what's going on in it. And if I could empower other artists to have the opportunity to show their thoughts and their feelings, that's something that I would like to do more of. But I'm doing exactly what I want to do. I'm sorry. It's boring. Yeah, I am.
Enviable place to be. I wonder if we can do a lightning round as we're getting ready to close here of do you have is there a specific fact or one idea that you would like people to leave with here from this event?
I have one.
Great.
Donate blood. So a lot of blood drives have been canceled when we've all been staying home. and we need more blood. So donate blood.
Thank you. I'm going to ask a follow because there were a couple of questions around the plasma and the data around the plasma there. So I'm actually going to pause for a moment about the question we had, and I'm going to ask that question here, which is in terms of the plasma and the research around the plasma donation as a form of antibody. Wayne, Ted, can you weigh in on that, or?
Well, so one of the things we've already seen, and we've seen this in the animal models, is that the blood out of individuals who have been infected and who have recovered has neutralizing antibodies against the virus. Mm-hmm. And so these are now in development as antibody products. So it's really important and I would just want to echo what Ann said. If you've been infected and you have recovered, you may have these broadly neutralizing antibodies in your blood. So you should go and donate this blood and let the scientists look at if they can identify antibodies in your blood, which can help others.
Great. Ted, do you have an idea, a fact that you want to have people leave this event with today?
Yeah, I think that, building on what Ann said at the beginning is that, we're all in this together. And when we reach the point where we do have a vaccine and we may not have enough of it, that we really consider how the people who are most vulnerable and how together we can end the pandemic, whether it's frontline health workers, whether it's the people who've been manning the grocery store delivery, or it's people in other countries that don't have access to capital or technology. And the only way that we end the pandemic and that we eliminate the virus is that we think in that manner and we don't break down into our silos, our nationalist silos, or group silos.
Wayne?
Well, I just want to leave the audience where we want to be about a decade from now. And about a decade from now, we want to have made the initial artificial intelligence model of the human immune system. So instead of the world having to spend hundreds of millions of dollars on one pathogen or another pathogens, we can have machines which in silico are running hundreds of thousands of clinical trials and giving us the same answers. So help the Human Vaccines Project. I'll leave you with that.
And Jeannie?
I was sitting here thinking about artists and what they're creating now. And one of the things that popped into my mind, I think is really important. And they're creating masks. They're creating representation of masks. And I think that's a really good time to be making direct statements and stories about ways that we can take care of ourselves. Final thing for me to say is wear a mask.
Great. Indeed. I think we've come up to the end of our time. There's still so many questions that I would love to have a chance to answer, and some very specific ones that I know that Rick and Ann have seen in the thread as well. And apologies for not being able to get to all of them. There were so many good ones. So thank you so much. And Ann and Rick, take it away.
Thanks to all of you. This was such a good discussion. And I have to say, especially the last few remarks. So Jeannie, I know that you had said, there's my dog right on cue. Chickens, dogs, I have an entire menagerie here, clearly.
Guys, we're professionals. We're professionals here.
Yeah, clearly. But I heard a baby in your background, Sonny. So,
well, and Ted's got a baby in his background too. He's got a not quite 1-year-old also at home, and we know Ann has kids, so everyone's kept the kids at bay.
But thank you all of you for this. And yes, we have our masks. And Wayne, I think that you were reading from Marcia's script when you were talking about the kinds of science that we can translate today into the ways that this needs to be applied for so many different reasons, that it's not just COVID related. There's a lot of lessons that we can take from this. So thank all of you. And bioethics, we have Berman on speed dial. So we can use a bioethicist for almost anything. This is an important conversation. As I said at the beginning, the Academies is convening a committee to look towards providing formal recommendations for when we do have a vaccine, how we should think about that. So come back and look at the Academy's website in probably September or October. I would imagine that there will be some headlines around that at the time. In the meantime, this has been an incredibly valuable conversation. And we appreciate all of our speakers, and thank you, Sunny, for moderating this conversation.
My
It's
pleasure.
really valuable.
I know it's being recorded. Will it be posted for people on the site?
It will be. It'll take us a little time to get everything squared away. We like to put some closed captioning on it. There are a few things that we have to do, but it'll take us probably about a week to get that up there, and then it will be on our website, and we'll make sure that we put the link in future emails that we send out. We also, I'll put a slide up, there will be some information about next week's event when we welcome National Academy of Sciences member Neil Shubin, who will be here. Yes, there's a good tease for it as well. So come back next week when we have Neil, who will join us at the same time next week, next Wednesday. And we're very glad that we had this panel next week, and we have just Neil, who will bring us home for next Wednesday. So come back next week.
Yeah, see you next week, everybody.
I'll have more videos of chickens.
I'll have more stuffed animals.
There we go.